The signature new day is dedicated to bringing you and to educating you about health issues. Since tomorrow is the World Hepatitis Day, we can't get tired about discussing this because it is very important for you to know and to have adequate knowledge on this. Now, to move further, we have another professor of gastroenterology who is going to be discussing and giving us much more insight on what we've started already. We're talking about the person of Professor Uche Ijoma. She's also a member of the National Technical Working Group on Hepatitis. She's going to be giving us much more insight. Welcome to the show, Ma.
Welcome to the show.
Thank you very much.
You look amazing, I must say.
Thank you. Thank you for the compliment.
Yes, ma'am. So please tell us, tomorrow is the World Hepatitis Day. Can you give us your own insight and overview of what it entails?
The World Health Organization,
Yes,
in its, I think it's the 43rd Assembly, saw the huge global impact hepatitis had on the world. So they decided to develop or to assign a day to raising awareness, bringing countries together, bringing governments together, bringing all stakeholders together for us to talk about this very important disease, hepatitis. So July 28th was adopted because it is the birthday of the Nobel laureate. His name is B.S. Blumberg. He's an American. He was the person who discovered the hepatitis virus way back in 1965. He also went ahead to develop an easy tool for testing and identifying the hepatitis B virus. So in 1976, he won the Nobel Prize for Physiology and Medicine. And then the World Hepatitis Day, as we know it today, started in 2010. Before then, World Hepatitis Day was being commemorated by different organizations on May 19th. But then this new date of July 28th brings together everybody, and it has actually led quite a lot of traction to the burden or to the diseases, the viral hepatitis essentially.
All right, Professor, given your expertise, your experience, how well would you say Nigeria has actually aligned to the mandate of the World Hepatitis Day?
There's a document we call the Global Health Sector Strategy on Hepatitis. It was also a WHO document, and it has involved about 94 countries.
Okay.
About World Hepatitis Day is celebrated in over 100 countries of the whole world, and about 94 countries are partners in the Global Health Sector Strategy.
Okay.
Now, it has an elimination target. We want to eliminate chronic viral hepatitis. As you have heard, we have different types of hepatitis. It's not just the viruses that can cause hepatitis. Alcohol is a major cause of hepatitis. Obesity and maybe diabetes can also give hepatitis.
Prof, could you hold that thought? If alcohol, because I had this in mind when our guest was seated here, however, time wouldn't permit. If alcohol could cause hepatitis, what category of hepatitis would it be?
Alcohol can give you both the acute type of hepatitis, which is the short-term hepatitis.
Okay, in this case, it's not designated A, B, C, D, or E.
No, that I was coming to that. So what we had earlier is what we call the viral hepatitis. These are the infections, the germs that cause hepatitis. We have alcohol being a major cause of hepatitis, both the acute form and the chronic type. We have other toxins. The supplements people take contain some substances that can cause hepatitis. You and I, we live in the tropic and the subtropics. We have our grains. When they get contaminated by a mold, that mold will produce a substance that can cause hepatitis. That substance can also go ahead to even cause liver cancer, like we have, like we spoke the first time. We have some other forms of hepatitis that are inborn, what we call autoimmune. The body sees its liver as being foreign and then tries to eliminate it. So that's another form of hepatitis. So hepatitis, we have the infectious types, we have other caused by other things. Then some people have some genetic predispositions. They deposit certain substances on their liver, not just the liver and other organs. Some people deposit copper. That copper we deposit on the liver can cause inflammation, which is inflammation of the liver, which is hepatitis. It can go ahead to cause other things. Some people deposit iron. In fact, it's been found that in certain communities, especially in north central Nigeria, where there are some cultural practices for new mothers, they use a specific iron pot. They have high levels of iron in their blood, and they've been found to have high levels of hepatitis caused by this thing. So there's a whole lot of things that cause hepatitis. But by far, in this part of the world, we have viral hepatitis causing a large amount of hepatitis. So the global strategies are aimed at reducing the levels of this chronic hepatitis so that we're actually looking at a hepatitis-free community. Okay. So back to the question, what have we done? The key statistics for the global strategies for elimination of viral hepatitis by 2030, it's quite a big aim that we have. We know there are going to be challenges. We want to reduce all new infections. All new infections.
What's the strategy?
By about 65%. Okay. We want to reduce death by 90%, sorry. We want to reduce deaths by 65%. So different countries are working at various levels, at various rates. In Nigeria, that was part of why the technical working group was set up. I think that's by the Federal Ministry of Health, and it's done quite some work. It has established the national national strategic policy. We have the national strategic plan. In 2016, we published the first national document, the guidelines for the control, prevention, and treatment of viral hepatitis in Nigeria. That document was updated and a revision was done to 2023. So what are the strategies? Okay. Their main aims. First of all, we must increase awareness. As high as 90% of people who have viral hepatitis B are completely unaware of their illness. I think that's a huge number.
Yes. It is.
As high as 80% of people who have hepatitis C are unaware of the illness.
Do they actually exhibit symptoms?
That's the thing. Chronic hepatitis is asymptomatic. There are no symptoms in a large number of patients.
Yet it also progresses to those consequences.
By the time most people are coming, anytime someone comes to you with a complaint, oh, my legs are swelling, or I think my abdomen is swelling, we already have consequences. So what's the first strategy? We must improve awareness and testing. That's absolutely important. If you're not, and the aim is actually when you improve awareness, people who have the disease will know and then begin treatment. And our aim is to reduce the pool of persons who can transmit this disease. That's the first strategy, awareness. The second strategy is what we call linkage to care. You must identify these people, make confirmed diagnosis, give treatment, and of course, this is also trying to reduce the number of people who make up the transmissible pool for hepatitis B or C. Then the other strategy, which is a major strategy for us, especially in the developing countries, is prevention. We have included hepatitis into the national MPI, the National Program on Immunization in Nigeria. Very importantly to us is the birth dose.
What does that mean?
The birth dose is that dose of hepatitis B vaccine that you give to a child within the first 24 hours of birth. Nigeria has a higher than the global percentage, 52, but Nigeria is not doing it exactly as it should be done. But to be very honest, I think it's a very good step in the right direction. What we do, because a lot of our births occur outside of the hospital setting, a number of us are in the urban areas. Don't look at those who are in the rural areas. Children are born there every day. Children are born in every part of every place. So our aim really is to give that birth dose the day of birth, the first 24 hours. But you and I know that it is not very easily
achieved.
Exactly. So I know it does, or what is like they'll get it within the first 2 weeks of life. We have frowned against that, but it is better than not giving the children anything, because that initial dose is very important before the child is really into the community, where grandmothers will come and pick the baby, neighbors. And if you understand our communal society, which I think is very good, you cannot do anything about that. So the important thing is to give this child the birth dose. I'll come back to this later.
No, but before you do come back to it, is the 2 weeks, is it effective?
Tough question to answer, I must agree. The aim is to give it, because the first dose and the second dose, you must have 4 weeks. That's for that. So
can you please enlighten us?
We may not have all the time to talk about all.
A few, just highlights.
Yes, so, when you give the vaccine, the question is, what does the vaccine do?
Yes.
The vaccine is an altered version of that organism, that exactly whatever trying to prevent.
Yes.
When it goes into the body has an immune system. It begins to activate the immune and develop what we call bodies against that particular virus. So vaccines for polio, we have vaccines for tuberculosis, we have vaccines for whoop, we have vaccines for influenza. There are so many things. For us, child immunization is a major mark for us to achieve. So we want, for best a production of antibodies in terms of number, we want, and quality, we want that 4 week between one and the other. So after the birth dose, the second the birth dose, because of the difficulty in vaccine uptake, you imagine a woman who sells, who has a shop in the market, and then she has to carry her child every time to the health center to get a vaccine. So the nation, in its wisdom and with its partners, added hepatitis virus vaccine to the existing vaccine we used to give children. The one they take at 6 weeks and 14 weeks. And if you look, you can see there are 4 weeks interval between them. We know that most centers, if you come with a child older than 2 weeks, most centers will not accept to give that's another matter. So we encourage the birth dose is very important. Some countries have achieved it. Nigeria is actually doing fairly well on track to that in that respect. All we are doing is trying to eliminate viral hepatitis with the indices I have given. Right. So the major things are awareness, getting people tested, treating, prevent, and then more importantly, we need to people who can care for hepatitis. That's very important. We are extrapolating from the 2006 extrapolated to date. We're about 229 million. We have just 100 gastroenterologists in the whole country, both specialists and trainees. So you can see that there is no way our number can go anything near taking care of the numbers in Nigeria. Prevalence is the rate of the infection.
Yes.
For hepatitis B, we have 8.1. We have actually improved. We were at 13 points before. In 13, the study done in the 6 geopolitical zones by the working group and the Federal Ministry of Health, we had 13.1%. There's a very popular study that is called the NICE study. It's now AIDS Impact and Study Survey. The NICE study in 2019 are prevalent to 8.1.
Okay.
So if you look at 8% of 229, so we have close to over 20 to 20% living with viral hepatitis or chronic viral hepatitis B and C in Nigeria.
Okay, Prof. Nice statistics, really boggling though. So, quite recently, there was of hepatitis vaccines. So, the question is, if someone had taken a hepatitis vaccine as a child, would the person also be able to take, this vaccine, hepatitis vaccine that is being, advertised? Really is just give us the picture of what plays out.
So if a child has been successfully vaccinated, that's taking the and taking the 3 subsequent doses, the pentavalent, we believe that that child is protected for life. Now, there are 2 major schools of thought. Some people have talked about those at 10 years later, 25 years later. Is that once that virus comes in, once you contract that virus, after the initial immunization, the logical memory that has been initiated by that initial vaccine gets in. We have tests that we can do to measure, excuse me, to level of.
Sorry.
Excuse me. We have tests you can do to measure the amount of antibodies you have for the expressed. So yes, some there are advocates for booster dose at about 10 years or a booster dose at about 25 years. But whether you take the booster dose or you have not taken it, if you have completed your immunization, safe. For those of us who work in the hospitals, a number of times, the younger doctors, I'm woken up many times in the morning, somebody has had a prick, and it's from a hepatitis B positive. They have identified the index patient and they know the person is positive. And I asked, been vaccinated? There's nothing, just reassure the person. So that is the sense of the vaccination. We understood the importance of vaccination, and that was why included in that popular triple vaccine children take. Vaccines save life.
Okay. We're discussing hepatitis. We're going to be going for a very short break. Back, we'll still be with our Professor Uche as she gives us more insight. See you after.
And this is still Signature New Day. We're still here unpacking infectious diseases and epidemics with focus on hepatitis. Here in the studio, still seated with us, is Professor Uche Ijoma. So, Professor, we were discussing about tomorrow being World Hepatitis Day, and you being a member of the National Technical Working Group on Hepatitis. What are some of the activities, or if you can, all of the activities lined up to commemorate, tomorrow's event?
The National Technical Working Group is a big group. For me, for World Hepatitis Day, we have smaller groups, and that's where we think we're more effective. We want to bring this closer to the grassroots. In the University of Nigeria Teaching Hospital, in collaboration with the Medical Students Association of UNN, the publicity and health campaign sector, and some NGOs, non-governmental organizations, we are organizing a campaign, a health education and screening campaign. We also have some pharma groups that we have contacted that are going to supply the screening kits free of charge. And we're hoping to screen up to 500 students, not just medical students. We're going to, the center is in the University of Nigeria Enugu campus, because we had planned it for today actually. But because today there's the matriculation exercise for UNN, it's going to be exactly a week today on the 3rd of August. So we're also inviting the public. We will take as much as the kits we have can take. These exercises are not cheap, and we thank the pharma groups that have supported us over the years. So for this year, we're going to have an education and screening program at the University of Nigeria Enugu campus. The starting time is 9 o'clock. That's the program we have for this period, including the media campaigns, because this is absolutely very important. The media will get to a larger number of people.
Yes.
Even they may not be physically present, but they will hear what we're talking about.
Okay, so thank you very much, Professor. According to UNICEF, around 2019, it was estimated that about 25,000 babies have been birthed almost every day. Now, you've given us statistics about the number of people we have, number of trained staffs we have on ground. Are there programs in place to be able to train people in order to be able to combat hepatitis?
Yes. We are trying to decentralize care. We want to decentralize care. We want to have care in places outside the hospital. But we have a challenge, especially in our communities. We are already training the TBAs, traditional birth attendants, to look at delivery. But the vaccines we have are cold chain vaccines. So that means you must have
a freezer.
Exactly, fridge.
Or fridge.
A fridge to be able to keep it. I know there are some centers in Nasarawa State. Nasarawa State has a very beautiful success story, especially with regards to hepatitis C. But then I know some NGOs move into the communities, mud, sand, do a sand bath and bury the vaccines inside. I know in OAUTHC, Bafemi Awolowo University Teaching Hospital, a group of doctors have come together. One of them, I did part of my subspecialty training in Ife. My trainer then, in association with some other pediatricians and gynecologists, they had actually donated some things to the delivery room. So in Ife, I can tell you that any child who is born, whether it is a Saturday or a Sunday, at midnight, at 4 a.m., gets the birth dose within the first 24 hours of birth.
Wow.
So these are programs that are ongoing. We want to train people to be able to, the technical working group actually has organized lots of trainings. There's what we call the TTT, train the trainers.
Okay.
So we get trained and then we step down, cascade down that training to other to other levels of care. We actually want to move it to the primary care centers, to the primary health centers. They should be able to do basic hepatitis B, hepatitis C screening. There's what we call reflex testing. You have come for something else. We use that sample, we test for hepatitis B and C. When you come, we give you your result. That is what Nasarawa State has done, and it's been a very beautiful, the experience has been quite rewarding. Training is difficult. You also need to, there are different levels of training. You have training in secondary care, we have training for the primary care. In fact, a few weeks ago, I was meant to go to Owerri as part of the technical working group to train officers in the State Ministry of Health. So yes, trainings are going on. But what I know the federal government, what we have discussed at the group, we want the various states to key in. So, you know, when the states key in, that's what we have seen with Rivers State, with Nasarawa State, with Lagos State, Imo State now. I hope our Enugu State will come on board.
We're hopeful too. Ma'am, let's go to vaccine hesitancy and the issues around it. What are some of the challenges that you're experiencing yourself, your team, elsewhere in Nigeria, in rolling out these vaccines? Because it's one thing to roll it out, it's another thing for the people to accept it. Let's just hear your thoughts.
In 2022, the federal government actually accepted to begin to develop vaccines in Nigeria.
Outside of Gavi?
Well, we want to begin to the development of those vaccines in country.
Wow.
Gavi actually helps. Gavi actually facilitates and sponsors and takes the burden for most of these vaccines we do. So the vaccine hesitancy, it's real. That's why we have vaccine uptake at things like 52% or less. The important thing is talking to the people, enlightening them, educating them on the importance. It is very easy to see. Before, in the 4 decades ago, we had lots of people with polio. I don't know how many children you have been born with, seen with polio, deformities from polio. That is the practical example I give most parents, especially mothers. So if this can happen, then we should let it happen for other diseases. It's easier for us for the childhood immunizations because it's been added to the vaccine they take at 6 months, 6 weeks, 10 weeks, and 14 weeks. So every mother who is bringing the child for that vaccine automatically gets the hepatitis B vaccine. But yes, vaccine hesitancy is a very real problem, and the basic thing is education, enlightenment, improving people's knowledge. I think we'll get by over time.
So, as a member of the technical working group, what are under the Ministry of Health? What are the achievements that we can have from you?
Oh, quite a lot. I talked about the development of the policy. First of all, you need policy. We can say as much as we do, as long as you do not have government backing you, you cannot do much.
Do you have government backing?
Yes, it is a Federal Ministry of Health function. So we needed to develop a policy. So the policy has been developed and revised. We have a strategic plan. The strategic plan says what we plan to do over, we have, I think it's 2023 to 2027. That's the one that is current now. And then we have developed a guideline. The guidelines are to guide or to encourage or to educate those who manage hepatitis B patients at all levels. Remember, you can have very severe complications. We are not encouraging non-specialists to manage any complicated case. You do a test and somebody is positive for hepatitis B and he has leg swelling. Please send to the specialist. Send to a specialist hospital. We have 2 specialist hospitals in Enugu as it is now. We have, government specialist hospitals, a number of mission-run hospitals who have specialists. This has gone beyond the management or beyond the management of a non-specialist. So once you identify that someone has a complication, it is no longer room for management by somebody who is a non-specialist. So the guideline is to guide the specialists, because we are varied at various levels. Then we also want to bring the family physicians on board, the general practitioners on board. A lot of patients will get to them. So we want to train. I've actually been part of the training of the State Ministry of Health. That was in 2017 when they trained key professionals in the state. So yes, then the technical working group is also we're also moving ahead to do collaborations. Advocacy is very important, and we need to bring on board major farmers, stakeholders, NGOs, patient groups. These patient groups are very important because when you have patient groups are people who have hepatitis B, who go into the community and talk with other patients. The technical working group is a very vast group. We have patients in the group, we have NGOs in the group, we have pharmaceutical companies in the group. So it's a very large and potent group. But all stakeholders, all of us are stakeholders to the improvement of hepatitis management in this country.
Yes, Prof, thank you so much for that robust explanation. You have mentioned a couple of groups and associations, farmer groups, patient groups, NGOs. My question is, what about collaborations with other probably tertiary health institutions? Like we know UNTH is like a standard because it's a federal teaching hospital. What about collaborations with, let's say, state teaching hospital that also have enough patients? You know, what are the specific relationships and collaborations you have to ensure that there is a very good quality hepatitis patient care in these facilities?
We have as a gastroenterologist, we have an association in the country, the Society for Gastroenterology and Hepatology in Nigeria, SOGIN. We're just back from our national meeting in Jos. We have members in the state teaching hospitals. So it's that's the beauty of the guideline. SOGIN itself also has its guideline. The beauty of the guideline is that it guides all of us everywhere we are. So the technical group does not particularly need to go to individual physicians or individual gastroenterologists. That's why we have that document that guides everybody. And yes, last year, the World Hepatitis Day activity was in Enugu State University Teaching Hospital, organized by the community public health physicians and the gastroenterologists. Yes, community medicine physicians and the gastroenterologist in there. So I'm completely aware of this fact. So what we do is that we move it around from center to center over the year. It is every year. So last year, I know ISUT had a very robust program with the farmer groups. This year, we're moving it to the students in the university. We have had programs in churches. We have had programs in villages. We have gone to Ogu. We have gone to various places for this program.
But the theme for this year is time for action. Has it been that action has not been taken over the years?
Yes. 2024 World Hepatitis Day theme, it is time for action.
Yes.
We want more collaborations. We want to increase the actions. We want to step further the actions we have been taking. No group can do this on itself. So I think it's time we all come together collaboratively. There's always a part everyone will need to play. And the action is we need to do something differently from what we have been doing before. It's not that we have talked about hepatitis for a very long time. If you look at the first World Hepatitis Day on July 28, that was in 2010. That was in 2010. This is like 14 years down, and we're still moving at it. So we want to do things differently so that the statistics we have will begin to change.
All right, Professor, there was something you mentioned in the beginning of your interview when you were talking about the causes, things that could cause, hepatitis. You mentioned alcohol. You mentioned something quite interesting. You said supplements. I want you to elaborate on that because I know, for example, when people complain about maybe bone issues, maybe postmenopausal women, they'll be like, you don't take supplement, go buy this supplement, go buy that supplement. please
Honestly,
educate us on
you read my mind.
on supplements and this it being a predisposing factor to hepatitis.
And please, before you go, you said something. I wrote it down. You said there were ingredients in those supplements. So please educate us so that we can watch out for those ingredients.
Some people say, "God, I beg."
Okay, let me start from the particular example you used. As people grow old, especially women, we begin to develop osteoporosis from age, and then the menstruation stops, and then all that happens. This vitamin, they're called supplements. It means that they're meant to add to what dietary is available. They're not sold. Unfortunately, many of us take them as sold. They're not drugs. They're not medicines. Sorry, we no longer use drugs really. They're not medicines. They are supplements. They are substances that the body needs in very small quantities. I see people taking 1,000 milligrams of vitamin C, 2,000 milligrams of vitamin C. Of course, the COVID era brought on that. But you see, vitamin C is what we need in about less than 100 milligrams. That's what the body requires daily, every day. That's the truth. But then vitamin C has so many uses, including cleaning your bowel. So we can use different doses to do different things. So yes, there are certain supplements, may not be all of them. There are certain supplements that contain some substances that are known to injure the kidneys and the liver. So please, when you take up any pack, you need to go through all that. There's what we call aristocolic acid. It's like I'm trying not to use very big jaw-breaking words.
Does that have anything to do with aristocracy?
Absolutely not. But that's what it's called.
Okay.
So there are certain substances in the supplement. So please, whenever you want to buy any, you need to turn the pack and look at what it is. It's just the same thing we tell young women, especially when they want to buy creams. So you must look at it to make sure it doesn't contain certain substances that are lightening and, of course, detrimental to the internal organs of the body.
Okay. So can you just list maybe one or two of these ingredients, just to be because I want to be very careful when I go to the chemist to get drugs and watch. Okay, I know this. The
known one, the ones that are very clear and known, is aristocolic acid. That one has been looked at, but I'm sure you may not even remember this when you go out.
No, with aristocracy, you will remember.
Please remember that name very well, please.
All right, Prof. Let me take you back to maternal health. The previous interview we had, we spoke extensively on giving the kids vaccination at a certain time after birth. What about the mothers? When we talk prevention of mother to child, what exactly are the activities or maybe drugs, treatments that you can give a known mother, a known case who is pregnant, to make sure that she doesn't transmit it, or to reduce the burden, of transmission to the child? Something you do before the child is born.
Those are the challenges, I must admit. If a mother comes regularly to antenatal, we will be able to pick that. Unfortunately, most of our mothers come in as unbooked patients. So one, we encourage every woman to have at least one antenatal visit. In fact, to have her regular antenatal visits. It's not very easy, depending on accessibility to from where you live and a hospital. So every woman during pregnancy gets hepatitis B, hepatitis C, and HIV screening as a battery. So if this woman is found to be hepatitis B positive, we do further tests to decide if she's highly infective. There are tests you do to say, oh, this person is highly infective, we need to protect this child. Many of the patients, of a truth, may not have very high values, so you just monitor them and then manage the child when the child is born. So that's one thing. Antenatal care is mandatory, is a must. We also accept the drawbacks. If you find that a woman is positive at that time, there are certain drugs we need to give. This one is no longer within the limit of what non-professionals can do. This is usually treatment done by the gynecologists or the obstetricians, and a lot of times we get involved as specialist gastroenterologists. That's two. The hepatitis virus usually does not, the infection does not occur when the child is in the womb, usually. It occurs during that process of birth. That process of birth. So if the mother is highly infective, there are certain drugs we can give towards the end of pregnancy so that the viral load will reduce. The new WHO guideline, which was released in March 2024, has very new recommendations, because for women of childbearing age, the woman has the first baby, you start and stop, and then gets pregnant for the second baby, you start and stop. So we're actually advocating treating women of childbearing age who are positive, because we don't want to develop resistance to the drugs we have. So
another issue on its own.
We don't want to develop resistance to the drugs we have. So for us to begin and stop, stop, it's good trying to protect the baby, but it's not very good for the mother. So these are the newer recommendations we have in the new PMTCT documents for WHO.
Okay.
So then further answering your question, you say, well, what can we do? If the values are very high, there are certain injections we can give the baby at birth, but of course those injections are very expensive. But what we advocate is the birth dose, start the birth dose, and then complete the other 3 doses for the children. Once that baby is vaccinated at birth, can put the baby to the breast. There are absolutely no risks, yes.
Okay. So now, how about drug availability? How are these drugs, how easily are they accessible by the public? Can I just walk into, go to the doctor, get prescribed, go to a chemist? Are they that easily accessible?
The drugs for hepatitis, for hepatitis B, we have effective treatment. Cure is a bit difficult. Some people can actually spontaneously lose the virus, but we have effective treatments that will prevent complications and keep the viral load down. For hepatitis C, we have a cure. We're able to, currently the drugs we have for hepatitis C can cure hepatitis C, so that's a very good positive. Availability, again, the drugs for hepatitis management treatment have been included into the essential medicine list. That's a very big achievement. That's a very big achievement. So that means that most major hospitals should have it in stock, and actually I think a good number of them do. The drugs are available. Costs are the costs may not be
user-friendly.
Exactly. Affordability may be a challenge, and that's part of it was included in the essential medicine list. They're essential. We have a large pool of patients, and they are very useful. Affordability is a challenge, and that's part of why we're advocating universal health coverage for everybody. We need to have an insurance scheme, a health insurance scheme that works for every Nigerian.
That's right, Professor. Just a follow-up to this, because we know of antimicrobial resistance when you come to antibiotics. Most of the drugs we have currently are being resisted by organisms. Do we have the same scenario play out with antivirus, especially the ones that have to do with hepatitis? Or is there an impending probability that there could be, resistance, coming up somewhere with antiretrovirals?
For the antibacterial organisms, yes. Because we don't have a regulation in Nigeria, we have a lot of over-the-counter medications. You can walk into any place and buy any antibiotic you want, and that's part of what has fueled the resistance. For the drugs for hepatitis B, the drugs we were using 10, 20 years ago, the tablets we were using, we found that patients developed resistance to them. So we now had new agents, what we call mutated agents. They had changed their,
the morphology
exactly. So they are now mutations, and those mutants were very difficult to to treat. The first line drugs we now have high fidelity. That means that we have not recorded significant resistance with the antivirals we use for hepatitis B, and that is why we are pleading for people not to abuse them. That's also part of the reason why we have new recommendations and the PMTCT document guidelines. So most drugs have a propensity for resistance if you don't use it correctly. But what we call the first line drugs we use for hepatitis B, it's not yet documented.
All right, Prof. I wish I could keep you here for longer. Permit me to say that you're a walking, talking encyclopedia when it comes to hepatitis. So thank you so much for that wonderful expose on hepatitis. And that is about much that we can take for this segment on hepatitis and all that has to do with it. Do stay with us. When we come back, Internet Watch. See you.